Hi, everyone. So this is Stephen Freiberg here, aka the Dad Anesthesiologist. I'm going to start a series where I interview some of my fellow physician colleagues who are also fathers. We talk about medicine and fatherhood and parenting. And so the very first one I have today is a very good friend of mine, Dr. Devon Carr. Devon and I met in medical school, and we've become fast friends. He's one of the nicest people I know, one of the funniest and smartest people I know, and he really has a pretty interesting career. So he will be our first subject. I apologize for any technical issues or difficulties, but we got some great questions for him. I'm sure he's got cool answers. So Devon, thanks for hanging out with me. I guess we would have been doing this by distance either way, but certainly with what's going on now, we would have done it by Zoom. And so here we are.
Absolutely. Happy to be here.
Thanks, Devon. So really, I guess just to start, tell us a little bit about your journey. How is it that you ended up in medicine, how you selected your current specialty, and what the training process was to get there, and what your current practice looks like?
Yeah, so really ever since I can remember, I think I wanted to become a physician. My dad's a physician, although he kind of does more of the non-traditional route. He was a physician for like a big pharma company. And but I think, all of us kind of grow up and we kind of emulate our parents. And I think that kind of put the idea in my head. And then kind of when I was thinking about it, I was like, it's so cool. You can, get paid just to help people and heal people. And, I did a couple of shadowing experiences kind of later in high school, then college, and kind of decided that it was what I wanted to do. I ended up at the University of Miami, where I met you for medical school. And then I ended up doing a residency and a combined internal medicine pediatrics residency. We call it MedPeds. And I think, when I was young, I'd always wanted to be a pediatrician. I really liked working with kids. But kind of in medical school, I realized that there's a lot of value in kind of treating the whole spectrum of life. And it was just really cool to be able to treat people, especially with chronic medical illnesses as kids, kind of into adulthood. And really my experiences in that kind of helped me on both fronts of medicine, which is nice. I mean, there's a lot of things that I deal with adults that now kind of apply to kids, unfortunately, like obesity and diabetes and high blood pressure. But I think, there's a lot to be said about kind of talking with a kid, and that applies to counseling adults too. So I think it's been valuable kind of on both fronts. After residency, I ended up doing a fellowship in sports medicine. I've always been interested in sports. You can see some of my memorabilia up in the in the background.
Like one of those Pennsylvania teams, right?
What's that?
You like some of those Pennsylvania teams a little
Yeah,
bit?
avid Eagles fan, hence the Super Bowl blanket there. Then big Phillies fan as well. But so yes, and like I've always been interested in sports. I was a swimmer in college too, and I think it really kind of plays well into primary care. I mean, like I would say probably about 30% of the acute problems that I see are related to joint complaints. So it really kind of gave me another niche to be able to kind of capitalize on. And so I did a year primary care sports fellowship at Emory. And now I'm practicing in a private practice in Athens, Georgia, where I do about 40% pediatric primary care and about 60% adult primary care, and then kind of throw in sports medicine in between. I'm the team doc at a local high school as well, so I cover like their football games and kind of go to the training room once a week to take care of some of the athletes there. So
It's really amazing, and I think it's especially unique in that not all the times are physicians able to marry their passions for medicine, obviously, and for someone like you to be able to marry it into something for sports medicine. And I guess a non-traditional route, one might think the go-to for sports or whatnot is orthopedics, but you've really done a really, I think, interesting and cool route to marry those two passions together. So tell us about medicine a bit. Now tell us about sort of your dad status, your dad journey. What does that
yeah,
look like these days?
yeah. So I have an almost 3-year-old daughter right now, Sahana, and then I have another daughter on the way. So total, daughter dad. And then, but it's been awesome. It's been, I think it's kind of been one of the most like exciting journeys so far. And despite being a pediatrician, there's so much like that I'm still learning every day about being a dad and about like keeping another human alive. So.
Sure. And so how do you balance the time commitments of both being a involved and caring father, as I know you are, and being a dedicated and caring physician?
Yeah, I mean, it's challenging for sure. And I mean, I think, it really kind of stems from, like, I could never do it alone. And I have a very supportive wife who's a fantastic mother as well. And I think that that's kind of one of the biggest things that's helped me for sure. But I think, you just have to, you have to make time. And that's probably the biggest takeaway. And so even for my schedule, I have weekends off, and then one of my days on my Tuesdays, I finish a little bit early, just so I can spend a little bit more time with Sahana and stuff like that too. And it gets hard though. It's medicine's is a very kind of unique field in that we work hard, we work long hours. I mean, even for a pediatric practice, I'm on call like 24/7. So I'm getting calls in the middle of the night sometimes. And, but you just kind of have to make do and just do the best you can, I guess.
I think I really like what you mentioned about taking those Tuesdays early so that you're able to spend more time with Sahana. Because I think when it comes down to it, what's so important is just being intentional with your time. And what that is different for everyone else, but you clearly make that concerted effort. And I think that speaks volumes. Just even those couple hours a day, I'm sure means the world to Sahana and you and your wife. So I certainly applaud you for that intentionality. And what do you think is the hardest part about being a doctor? You and I are comparatively new physicians out there in the world. And what do you think has been the hardest part so far?
I think the hardest thing is balancing that kind of like work-life balance. I think it's really easy to get stuck in just the grind of like going to work, coming back, writing notes, answering telephone encounters, and I think you have to take a step back sometimes, and you just have to know that you're trying your best, and sometimes your family's going to come above patient care sometimes, and that is just what it is. And as long as, obviously you're not doing any harm to the patient, but I think most people are kind of understanding. It's interesting. I think medicine has become very, I'm trying to think of the best way to explain this. Medicine's become very kind of almost like satisfaction based. And a lot of times, patients have become just a little bit more demanding, I would say, on certain things, and it's hard, I think, and they're in a hard position, they're sick and everything like that, but at the same time, like sometimes you just have to, talk to them and say, listen, I'm doing the best that I can, and we have a patient portal, and a lot of times, we reply to messages, and my wife and I, we talk all the time about how, sometimes we're replying to messages like 10 p.m., 11 p.m., patients are still getting upset. And you sometimes have to, talk to them, be like, do you realize I replied to that message almost at midnight, and I'm just doing the best that I can with some of these things. And you have to really just make a intentional effort to kind of put your family first sometimes. So.
And I think that, a lot of people might assume that primary care, so to speak, or even an outpatient focused specialty like yours in sports medicine can very easily be sort of a clock in at 9, clock out at 4 or 5 o'clock job. And that's so far from the truth. Beyond the long hours that you undoubtedly work in the office itself, something like primary care, especially as a pediatrician, it's almost, I feel like you're almost never not on call, even when you're not on call. It's just the way, I guess, technology and medicine is transformed. And I think in some ways for the better, and there's certainly some detractors to that as well. So
yeah, it's an interesting concept, because even, so Malini is, her dad is a physician as well. And he said that, back in the day when they needed to get a hold of someone, they would either, and this is, Georgia, but they would either go, they would go to church, or, go to one of the local restaurants and try to find the physician on call. But now with cell phones and everything, it's, we're so much more accessible, which, I agree with you, is kind of good, but also kind of bad. So.
Right. So certainly some of the challenge about being a doctor, but what do you think are some of the hardest parts about being a dad?
Yeah. I mean, I think especially as like a new parent, and you might be a little different now that you're on number two, but as a new parent, I think you constantly feel like you're doing the wrong things, and I and one of the hard things is you're it's kind of like the social media mentality. You're always like comparing to other parents and seeing what they're doing, and it's tough because I feel like you constantly feel like you should be doing this better. You should be you should be spending more time, you should be doing this. And I think that's the kind of hardest part, is kind of feeling guilty for feeling that you're not doing the best job, even though when in reality, you're probably doing a really good job. It's just the kind of the unknown, I think is the hardest part for sure.
Sure. So certainly those being some of the challenges, but what do you think is the best part about being a doctor?
About being a doctor or being a dad?
Well, I want to hear about both.
Okay, so being a doctor, I think one of the best things is just kind of, I think being there for people kind of at their most vulnerable is really powerful. And I really think if you have a positive impact on a patient, you will kind of be with that person forever. I think that's been kind of a really nice thing about being in a smaller town like Athens, is I see a lot of my patients, I guess for better or for worse, but on different stores, at restaurants, at like Sam's Club. I also have patients all the time. And I think just forming those relationships and is just really valuable. And it kind of really makes you kind of feel like you're part of a community, and that you're kind of doing your job to help people. So.
Absolutely. And what about best part of being a dad?
Yeah. So the best part of being a dad, I think it's like seeing things through your kids' eyes as they do it the first time. I think that's just like the coolest thing. And it could be like the smallest things that we take for granted when they see them for the first time, and they like light up or they giggle. I just think that that's just the coolest thing. And it just gets me every time. I'm trying to think of a good example with Sahana recently. I mean, even just recently, just being outside and summer's coming along and we have like flowers blooming, and she's finally, she's talking more and she's understanding a lot more about what's going on in the world around her. And she just gets so excited about some of these things. And it's things that we take for granted all the time. We're like, oh yeah, like some flowers, cool. But for her, it's just like, oh, like she's like, can I smell them? Can I do this? And just like the excitement of the kind of day-to-day is just what makes me excited too. And I think it takes things that you normally would take for granted, and kind of like, you're like, you know what, these things are like really beautiful, and I should appreciate these things a little bit more.
Sure. So all that being said, if, in 15 years or so, or knowing Sahana being as bright as both of her parents, I'm sure she'll develop a direction earlier than that, as well as your other daughter in the way. They say, Mom, Dad, I'm pretty certain I want to go into medicine. What would you say to them?
Yeah. So I would definitely encourage it. I would make sure that they're doing it that she's doing it for the right reason. I think I would make sure that she's not doing it just because she thinks that we want her to do it, or she thinks that, that this is just what she needs to do. I would just definitely try to encourage her to have shadowing opportunities, or just different opportunities to kind of immerse herself in it to make sure it's the right opportunity. But honestly, I do know physicians that are unhappy, but like, I'm very happy with what I'm doing. I know Molly's like very happy. I think as long as you find like something that you're passionate about and you go into it for the right reasons, like, I think it's a very rewarding career. I think if you're going into it for the wrong reasons, if you're going into just to, if people are going into just for a stable salary or something like that, it's not going to be right for you. But if you kind of go into it knowing that this is what you're passionate about, that, there's going to be some things that you have to grind on, but if it's, if it's what you love, then it really doesn't feel like work. So.
Right. And I think that echoes for a lot of fields, is that there's always going to be downsides to anything, but physicians and anyone in any profession, if there's still a passion for it and you're able to follow that, I think that's what helps really bring great happiness, when you can bring together things that make you happy and can also help pay the bills. Or I think it is the way to go. And so, as you have always been sort of my pediatrician on call, when I try to be sensitive to my actual pediatrician, I just call you in the middle of the night. But to maybe avoid some of that, what would your number one tip for parents be in
Yeah.
general as a pediatrician?
Yeah. So I would say number one tip is don't listen to what other parents have to tell you about things, because it's never like what fits for one kid never fits for another kid. And you probably seen this too, just with your two children. Like things that work for one kid might not necessarily work for the other. And I feel like a lot of times I see a lot with like new parents when kind of their parents come into the picture. So like, I guess the kid's grandparents, and they're like, well, they're telling me I need to do it this way. And then like, I think, it's every kid kind of works at their own pace. And I think you have to try different things to be successful. Parenting a lot of times is just kind of trial and error, but you can't take it personal. And I think you just have to try your best. But that would kind of be my best advice. Just try not to, get caught up in what other people are telling you that you should be doing, and kind of just try to do the best that you can yourself.
I like the trial and error comparison, and I can attest that we make a lot of errors. So
Yeah.
both the kids are doing fine so far. So, and I don't know if the advice would be any different, but separating your hats, if you can, for a moment, as a dad, what would your tip be to parents or other dads about parenting in general?
Yeah. I think it would be pretty similar. It would just try your best, just be present and try your best. I think that's the biggest thing. And in the end of the day, none of us are perfect. We're going to make mistakes. Kids are resilient. They're going to, most of the time that they're going to do fine. So it's going to be okay. Just, be present and, just try to put your best foot forward.
Absolutely. Well, Devon, Dr. Carr, thank you again so much for chatting with us. Tell folks, if you'd like, either where they can find out more about you or your practice or social media or anything, where they can contact you other than at midnight via the patient portal.
Yeah, absolutely. We have a good website at readymedicalgroup.com that kind of highlights our practice and what we do. So if anyone is interested in kind of checking us out, or if anyone's in the Athens area looking for a new physician, just please feel free to contact us. So.
Excellent. Well, thanks again, Devon. And for me, this is Stephen Freiberg, dad anesthesiologist. You can follow me on Instagram at the dad anesthesiologist, or check out my website, thedadanesthesiologist.com. Subscribe, give me comments. If there's someone you'd like me to interview or you'd like to be interviewed, let me know. And hopefully we can keep this going. All right, man. Well, have a good night. It's great chatting with you.
All right. Sounds good.